Hi everyone, today we're going to be diving into a serious but manageable heart condition called hypertrophic cardiomyopathy, also known as HCM in cats. So this condition affects the structure and function of the heart muscle and can lead to dangerous complications if left untreated. So like I said, HCM is a chronic heart condition where the muscular walls of the left ventricle thicken. That makes it harder for the heart to relax and it will fill with blood. So over time, the stress on the heart can lead to edema or fluid accumulation, especially in the lungs. So that is why some cats with HCM will have difficulty breathing or can sometimes seem unusually tired. So the heart is located in the cranial ventral portion of the chest cavity, which is right beneath the rib cage and between the lungs. So it lies just deep to the epithelium and subcutaneous tissues of the chest. So even though we're talking about a cardiovascular condition, it can also affect other systems in the body due to poor circulation. So, HCM is the most common heart condition in cats, particularly in breeds like Maine Coons and Ragdolls. It can often go unnoticed until it causes something severe, like fluid in the lungs, limb paralysis from clots, or even sudden collapse. So, these clots can lodge in metacarpal or hind limb arteries, which will cut off blood supply. So, again, it is the most common disease in cats, often asymptomatic and can lead to other conditions. So some clinical signs to watch for. Early signs are subtle. Some cats just seem tired or breathe a little heavier. In advanced cases, cats may suddenly lose use of their hind limbs. They could cry out in pain or show some skin changes like erythema, which is a reddish discoloration due to poor blood flow. But in some cases, cats may develop pyrolection, where their fur stands up when stressed or uncomfortable. But again, cats are very good at hiding pain, so it can be hard to watch for signs. So for how the body compensates, initially the heart will try to compensate by beating harder and faster. Blood vessels may vasoconstrict, which means to tighten up to keep blood pressure stable. However, this only makes the heart work even harder, and the thickened walls eventually will lose flexibility. So you can kind of see the difference in the thickened walls in this picture here in the normal heart versus one with HCM. So, diagnosis usually starts when a vet hears a heart murmur or an abnormal rhythm when they go in for a checkup, or you just think something's wrong, so you take them to the vet. So, we can confirm it with an echocardiogram, which is an ultrasound that lets us see the heart's muscle thickness and motion. X-rays may show fluid buildup, and blood work can also help us rule out other causes of symptoms like pyoderma or dermatitis, which can otherwise cause similar behavioral changes like hiding or lethargy. And it is, like I said at the beginning, it is a chronic condition. So depending on the time, really, so it does develop over time. However, cats may appear healthy until they suddenly experience acute complications like heart failure or even sudden death. So that is why early recognition is extremely vital. And those are my references. Thank you guys.